If we think a couple are at risk of transmitting a genetic disease to their future child, there's a test that's been around for many decades that can look at the specific gene that the couple are at risk of transmitting to their child. But there is a new test now called expanded carrier screening, and this is where we can test low-risk populations for hundreds of genes all in one go. So this is really a technique that is available for couples that don't think they're at risk of a particular disease, but want to know as a couple whether they could be transmitting a disease to their child. There's thousands of genetic diseases and they are quite rare, but that we are all at risk of transmitting a genetic disease to our child because the latest data shows that about 300 to 400 errors in our genes are carried by everybody, but they are rare. I think expanded carrier screening should be carried out on egg and sperm donors because we're all at risk of transmitting a disease, and we wouldn't want to use a sperm or egg donor for many years and then find out that they were at risk of transmitting a genetic disease. But since all of us carry a genetic disease, then obviously as we test for more and more genes, we will find more and more of the donors carrying a genetic disease. And at the moment in some countries, they have regulations that if the donor carries any genetic disease, we can't use them. So with genetic testing advancing in this way, this is really not sustainable. So what we are suggesting is that we would use genetic matching. So if we knew a donor was carrying cystic fibrosis, we would check the recipient and make sure that the recipient was not carrying cystic fibrosis. And this is going to be the only sustainable way forward with genetic testing and donors.